My name is Ogbodo. I am Nigerian by birth. I'm one of the GP trainees in the St. Helens and Knowsley training program, and I'm currently in A&E here in Whiston. That was really a jump for me, to be honest. It was scary initially before starting on this post. Obviously, as you would imagine, like it's a different system. Coming from Nigeria to the UK, I was expecting quite a number of differences already. But to be honest, it didn't feel as scary when I did eventually start, only because I think I had a very good team that made a lot of difference in my starting the job. I think it was a communication bit. I was trained in English, but I actually understand that we've got different accents and that could be problematic sometimes. So it was a major fear and worry for me. Starting out, I was worried, would I be able to fully understand what I was being told? And again, that proved to be true at the very start. I found it quite fast paced sometimes when I listen to native speak, and I think that's improved over time because your ears kind of get trained to these things, like you hear them repetitively and then it starts making sense. Yeah, but that was a major one for me. I was also worried a bit about the cultural differences. Again, I'm aware I was to expect some cultural differences, and that was something I was also looking forward to. I need to know what's different. I need to know how I would be expected to act that would be culturally appropriate. It would be to definitely ask for support if that's not already obviously being provided for you. I actually think there is always support. If you're not getting that, then you should be asking who do you need to speak to provide this. And it's a very big system. The clinical bits that we do as medical professionals, that's more or less the same everywhere. There could be just a few things that might be different, but I think it's just the systems. It's definitely different. And if you don't ask, there's no way to know. I mean, we already had emails a couple of months before the start of training. Those emails were quite helpful in at least knowing what to expect at the start of training. It's also good to know kind of what you expected to do at different times. That really helps if you're coming into a system where everything feels new, feels different. I also found very useful my clinical supervisors in my very first job. I mean, very few weeks before the start of the job, I already knew what I was going to do on the first day. I was going to collect my badges, get my passwords, and get set up with the practice. And I already knew trainings I was supposed to like complete. These are going to be helpful in getting used to the system. And I found that useful as well. The clinical bits, very much the same. That's a given that you would get better in the clinical bits anyways. As you go to work every day, you would meet clinical scenarios that are a bit different to what you're probably used to, and you're going to read up about that and get better in that regardless. But I think the systems, that's one I think we should focus on, only because that's what's really very different from what we are used to. So get to ask questions about the systems. It's a very, social care is very big in this country, so you need to ask and know about this. Sometimes you've got to refer people to services that are not in the hospital or in the general practice, and if you don't know all of these services that you could be referring patients to, then that's going to make your work difficult. Well, it's been 10 months roughly, and I'll be very honest with you, it's been a massive change. Who I've been, who I was as a person when I came in. I mean, not to say I've changed my identity, but obviously you're in a new system. There are ways things are done in this new system. And I've had a friend say to me, it's also important to listen to what's not being said. If you're in this country, like you're obviously listening to what's being said, but are you also listening to what's not being said?
Right.
Because sometimes that's really where the message is. So I am big on quality improvement, especially processes. I'm also big in primary health care, public health, and I've kind of been thinking how I would be able to like marry all of this together. Obviously, they've got links. Um, I've just been thinking what it is. I would obviously need to do further trainings. I already have plans for that beyond completing my GP training, but I would be focusing mostly in primary healthcare, improving processes and making systems more effective and more efficient, really.